Welcome to the River Park Dental Show. This is Dr. Sauer, and I'm here with Michael Morris, and we have a special guest today.
Yeah, we should go ahead and introduce her, Doc. Missy Fast is here, who also you know from your office.
Yes, it's very exciting. She's our hygienist.
Missy, say hello to the good people.
Hello, everyone.
Why don't you kind of give a little background on yourself, Missy, as to, I know that you came from a previous employment in Worthington, right? And now you're with Phing. Give a little background on who you are, kids, family, all that.
All right. Well, yes. So I did previously work in Worthington, met Dr. Sauer, am now in River Park with her. And it's fabulous. I have 3 grown children, so no, I no longer have any little ones.
Your daughter is a hygienist too, right?
My oldest is a hygienist also, yes, and she has 3 children. So I have 3 grandbabies too.
What?
She doesn't
I
look
thought
like
you were
it,
like
right?
30 years old.
Yeah, she doesn't look like a grandma at all.
I just tell everybody that, but yeah.
I
You
feel
left
old
my
now.
secret out now.
You're
I
somewhere
feel old.
between 30 years old and 80, so I'm just going to say I cannot believe that. But let's talk about the hygiene part of this. You've been a hygienist for how long?
For 18 years.
Wow. So when people hear about hygiene, and Phing and I have discussed this before, I know a little bit about hygiene. I was married to one of those people before. So I had
One
to
of them.
hear...
It's like a club.
Yeah, well, as I told you before, I'm going to try to find another one because I really like to hear about dental procedures and about tartar. That's like my favorite things. I'm
Yeah.
sure that's what you talked about at home, right? With your kids, tartar,
Well,
plaque.
yeah. No, it was more cavities. Brush, floss, there will be no cavities.
That is a terrible subject to come home and talk about, but can you give people kind of like an overview of what a hygienist really does, though? I mean, I think everyone thinks they understand it,
Right.
but what's your day-to-day?
Day-to-day is actually more involved than just cleaning teeth and making them feel great. So it really is a total health assessment. It is something that we're in a health technology. We went to school to learn more about the body than just your teeth. So when you come in, we are assessing overall. How healthy are your gums? How healthy is the head and neck area? We're doing oral cancer exams. We're cleaning teeth. And sometimes having to do something a little more involved with a teeth cleaning if it's been a really, really long time. And maybe there's some bone loss and some gums that are bleeding. It can be a more involved situation, but it is something that we assess everything.
And so you kind of like are Phing's like investigator. You're looking at the crime scene and then she's coming in to clean it up?
Yeah, well, not necessarily that way.
Yeah, but that was a great description of anything. You should
really
go with
is.
it.
I'm sure for the crime scene.
Investigator is a definite. You know, it is oftentimes I am spending more time. I have more time to spend with that patient, and so I'm taking a
For our
thorough
first
look.
appointment, it's an hour and a half.
Correct,
Right?
correct. An hour and a half, and I'm spending a lot of time learning about you, what you like, what you don't like, but also really assessing what's going on in your mouth.
Phing, how does that help you? When you have a hygiene, like you have to kind of count on her. She's like your right hand.
Yeah,
she's in
no,
there.
it's great because, I mean, she takes all the x-rays for me. So while she's doing her assessments, I'm in the back looking at the x-rays and evaluating them. And then her opinion really matters because she's had all that experience. So she knows what cavities look like, and she's in there much more longer than I am. So when I come into the room, she'll point things out so that I can take a closer look at things. And it saves me time, but then it's just so the patient doesn't have to go through another eval that's long and extensive too. So she can kind of pinpoint things a little bit more for me.
And the experience I've had with hygienists, they seem to know everything about you. Or
They
they seem
know
to know your
everything.
kids, where they go to school, what you're into. Is that true? As
Well,
part of the investigation?
Well, yes, but you know, it really does depend on the type of office, and that was one of the reasons why I love Dr. Sauer. She wants to go back to that traditional way of dentistry. It's not seeing you in 15 minutes and shoving you out the door for the next person to come in. She wants to establish those relationships, and that's what I missed. I was in that type of a relationship with a dentist office for 14 years.
But the
you-
first
you
4
became-
were really good.
They were all wonderful.
Well, her first,
Oh.
But yeah, no,
she's been in 2 offices.
I've
Oh.
been in 2 offices, and I like that knowing the patient and that they feel comfortable to come in. And you see generations then. You start to see the grandparents, and then you see the parents, and then you see their children. And you know them. You know what they like. You know what they don't like. You know what makes them comfortable. And it just is more of a family. It's easier, I feel like, in many ways, to treat that situation when you know those people well.
Have you seen a lot of people that have come from, you've been in 2 offices before, that have kind of floated around because of you? I used to hear that with, in my previous married life, I used to hear that somebody would come just because of the hygienist who was there. It wasn't so much the dentist, no offense,
No,
Doc.
I agree with that. I think more people will follow a hygienist more than a dentist, because they will only see me for problems, but they see a hygienist every 6 months.
That's their time on the couch, right? That's their
It's kind of like a therapy, I think.
Right.
The lab one.
Many, many times, because we are often the first ones to hear when things have gone awry in their life, because life just hits all of us, and sometimes we are the people that they divulge a lot of information to. And that's okay. That's okay.
Well, it must have worked out, because if you have a daughter that's doing it, this has got to be a pretty good career choice.
I feel it is. It's good for me. I like it really well, and I believe she really likes it too.
As far as being in hygiene, I know you have to keep up with your, I almost said CE credits. See, I know this stuff. Your continuing education credits, right? You have to do that to keep up your license and to keep moving, right? What does that consist of for you? Because it's not, I think a lot of people think you're just checking them in, getting in the chair, cleaning, and moving on, but there is a lot of continuing education that goes on.
There absolutely is. So we have 24 credit hours we have to get in a 2-year period of time before we are relicensed. And that can be anywhere. Oftentimes it is left up to us exactly what areas we want to have more education in, and things are ever evolving when it comes to dentistry and dental hygiene. So it sometimes is difficult to stay on top of all of that, but it's important. So that's where the classes, sometimes it's online classes, sometimes it's back actually being in a classroom, but it is studying just like you would have in school, just to make sure that you are up to date with the information.
And you just came back from having to do CE, right?
Yeah.
It never ends. You guys are always learning something.
You always have to learn. Keep on learning.
And it's not just technology. This part I don't know. When you're doing your continuing education, can a dentist take the same courses as a hygienist, or are they different?
Sometimes. There are courses that I have taken that are good for dentists and dental hygienists, and then there are some that are very specific also. So it can be a combination.
But do you ever want to go to the ones that Phing's going so you can cheat? I'm just curious.
It's not.
She has 2 doctorates. We've mentioned that many times on the show. I just didn't know.
It's not a cheat, but there are some things that really pique my interest. And so, yes, there are many things that are dental related that I want to know more about.
But you'll be joining a study club, too, with a bunch of other hygienists. So
Definitely.
topics will be more geared towards hygiene.
You mean it's kind of like...
It's a club. It's a study club.
Well, listen, in my previous life, there was a thing called a tips club where it would be, this person is advertising, so 10 people would call on the same person every day. You kind of have the same thing in hygiene? You have a group?
Well, yes, there is a study group, but it is also nice because we don't think that we've seen everything, and there are times that it may be something that Dr. Sauer isn't aware of because it is very specific to dental hygiene. That it is great to get a hold of other dental hygienists and say, hey, have you ever seen this, and how did you handle this situation? Because I'm kind of at a loss. It's nice to have that sounding board, kind of see what they're doing.
Yeah, they are experts in that. I mean, I don't know a lot about. Trust me, you don't want to get a cleaning from me if you had a choice between me and Missy, because she is on it. I do other dental stuff, but she's very, very
So you're
focused.
the 30,000-foot view, and she's the one that's kind of like...
Yeah, she's very focused on the bone, the gum, the periodontal part of it. And you're right, I can see more of the aerial view, but she's very focused on that kind of stuff.
How does that relationship work between the two of you so that it function? Because, again, you're the first line of defense feeding her information. There are some things I'm sure that you're seeing or diagnosing that you're handing off, but how does that communication work between a hygienist and a dentist? I want Missy to go first. You're always on the show.
Oh.
And then I want to
I
hear
my
your
voice.
right. I feel like you're not talking enough, but I want to hear how this interplay works, because I don't think people quite understand that you're working symbiotically with each other.
Yeah, very, very much so. And really, even the conversation between the patient and myself, and then also is relayed to her. Because, sometimes they do divulge, I have a big fear, or I financially can't tackle all of this at one time. So when I'm even going to her, I'm saying, okay, this is the patient's concerns, and these are the things that I'm seeing. And this is where then it's kind of laid out between her and what the patient feels is their concerns plus what I'm seeing. It all comes together, and then she makes the final decision.
Is that how you see it, Phing?
It's perfect, whatever she
does. That is not...
I
feel like
no, but she
does.
Out. She does come to me first and gives me information that about the patient that, so to make sure that I'm aware of the things before I go into the room. Just so, like, if they're focused on one tooth, and I'm like, hey, you should focus on this other tooth. It doesn't help the patient. So she kind of helps give me, prioritize my focus. But then when I'm in the room, she gives me a rundown to what I need to look at so that the patient knows that we're all on the same page.
When you're looking for a hygienist, what is it you're looking for them to be able to provide? I don't mean this isn't an HR thing if you're going to hire someone, but what do you need her to do for you to best treat a patient?
So for my practice, since we have a lot of technology, they have to be able to learn.
Oh, that's a good point. You're dealing with all the robots and all that stuff. I wasn't thinking about that.
No, it's a lot of technology for a lot of I think a lot of the hygienists I've talked to, they're like, I don't know if I want to. That's a lot to tackle. That's just a lot to learn. I mean, it is a lot for me, but then they all have to adopt everything that I'm learning.
Well, you mean you're kind of forcing it on them because you love technology, so they better get with it?
Well, if they want to be in the practice, I do ask them, like, this is what I do. Will you be okay? And they're flexible. They have to be flexible with learning and everything.
Right.
Yeah.
Because as we've stated before, it blew my mind, the things that you had in there, because I had never even seen them, but it was like, just so offhand, like, yeah, that's what this thing does and this thing. But it's all glowing and lit up, and it's a really cool thing. Like, as a patient, it's cool to look at. But I just look at it like, if I was a hygienist and I had to know how to use this, there's got to be a lot of training that goes with that too, right?
There is. I find it the exciting side of it. I love learning something new. So to be able to tackle those things and understand what it does and be able to do it well, I think it's fun.
Well, and that's exactly the personality that I like.
Yeah, so how many Missys do you have?
I only have one, but if I could just clone her and multiply her, I would.
Maybe one of those machines in the back can do that. We don't know.
I don't know. Maybe I can. I'll do that in one of my science projects.
I wanted to talk about something because you talked about being able to do the oral cancer screenings. We just did a show on that, I think, 2 weeks ago. Mm-hmm. So you know how to use the Saurer?
She's the one that...
the
Velscope. She uses it. So she's the one who uses it. And then I look at the images.
I'm not going to let you use that on me, but that's good that you know how to use it. We did a show actually at the end of the month about it, and I think we squeezed it in. We got it like on the 30th, so we did cover it in quotes.
We had 2 days left in the month.
Yeah. We had 2 days left to go. Yeah, so technically we did a show on it.
But we decided it was a year long thing, cancer.
Yeah, we'll totally wrap that around later. It'll be fine. So we'll have to bring you on for that. But I was interested in knowing how you diagnose using that tool. Mm-hmm. Can you explain how when you're looking for oral cancer, when they're coming in, because we said you can come in anytime you want to do this, as long as the place is open, right? Yeah. As long as the doors are open. But kind of break down what that is, because we didn't really go into that.
Right. Okay, so there's a two-step process when you're doing an oral cancer exam. One is just clinically looking, taking a look at the patient's mouth, looking for anything, discolorations, lumps, sores, tender areas that should not be there. A little different from a bite on the cheek or something like that. Most everything in the mouth heals within a couple weeks. If it has not, they really need to come in and have us take a look. But then there are also those types of lesions that are the same exact color than everything else in the mouth. There may not be a lump or a bump involved with it. There may not be tenderness, and that's where the Velscope comes in. So the Velscope really is just a very bright light. The patient feels warmth. That's all they feel. That bright light then will fluoresce or darken those pink areas that look like the rest of the tissues, but show us through the viewfinder exactly where that problem area is, and we can take another look then at that spot.
So when people come in, they're going to see you to do these oral cancer screenings.
Oftentimes they will see me, correct.
Oh, you really got to sell it. You should be like, absolutely.
Well,
Even if you
she's the one that does it first, and then I come in and do it second.
Mm-hmm.
But 2 sets of eyes.
Yeah. So technically, we did continue our oral cancer screening message.
Yeah, into May.
Yeah. So
That's
now we don't have to do it the rest of the month. Let's take a break right here. You're listening to the River Park Dental Show. I'm trying to step on you. I want you to do more talk. Like I'm trying to hear you. What do you want me to say? I'm just saying, people are listening to this for you, not for me. And I feel like I'm stepping on you.
No,
when I come to you, you're like, yeah, cool. And like, don't do that. Don't like you guys to talk to each other.
Michelle? Be right back.
Yeah, but I already know everything.
Hi, Michelle.
I know.
Just
That's
kidding.
what we want them to
But
know.
you're
that
asking
know.
questions that
I get it.
people want to know. Like,
I'm
I
just
don't
saying,
know.
like, when I'm giving it to you and you go, yeah, I mean, sure. And you're killing me. And I'm like, you understand? You have to talk.
If I get a little stab mark with your
My
pen.
favorite is when she's just staring at you while you're talking, like, I totally approve of this. I'm like, I need you to look here, look here, look here.
You want me to just stare at you?
No, I'm saying I'm trying to hand it to you guys to talk to each other. And you just, like, I'm
Well,
like,
what do
so
you want me to step in?
I just need you to talk to her back and forth.
This is my first test. I don't know how to do
I
this.
know. I'm just saying, I'm trying to engage you guys to talk to each other. Because otherwise it's bing, 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 right? You guys have not talked.
Michael's wearing out his voice.
Yeah.
Well,
So,
what do you want me to talk about?
I want you to talk about in your practice what you see, right, between the two of you. Even if you're complimenting her, or you're saying, you're the absolute shits. It doesn't matter. You just have to talk to each other. Yeah, I know. I'll have to edit that. Do you see what I'm saying? Like,
No,
people need to
so-
hear you guys talking to each other that you get along, because otherwise it seems like I brought someone from the lobby and you're like, oh, she seems all right.
This is too much pressure. I still
It's not. You just have to talk.
Oh, you're doing a great job.
I'm doing all right.
I want to get into...
Michael's got to crack the
Terrible.
whip with Dr. Ping. But
What
you're
I-
doing a great job. You
What
sound
I'd like
good.
to do is get...
You make me
now
feel
why us.
old, though, because you're younger than me and your grandmother.
Do you want me to ask this question?
But
I would
You
like
I'm
to
the oldest of
ask
4
it,
kids.
and
I
then
just
you
turned
guys-
55
Uh-huh.
and have no kids, 9 nieces and
I'm
nephews.
not trying to tell
So when you
this
said,
about
I'm guessing you're about 40, and it's like, yeah, I'm a grandma. And like, oh my God.
there's no pressure.
This
You're-
is
But
really
then I thought, well, she probably started having kids when she was 18.
They're
I'm taking those muffins back.
19. It's close.
Yeah, there you go. See?
You're gonna get all mad about it. All right, Jim, are you ready?
Taking my muffins
Yep.
back.
You're gonna bring us back.
As the oldest guy in the room, I'm ready.
Welcome back to the River Park Dental Show.
Before the break, Ping, I did kind of cut us off. We were talking about, well, we talked about a lot of things. We
Yeah.
mentioned our oral cancer screening, which technically that'll cover us for June if we do that right there. But we have Missy Fast with us today. And one of the things I wanted to get a perspective on between the two of you is your office being into new technology, into constantly looking for the answers for the new things that you're trying to identify. Kind of break down how you guys work together. Like, from the time that a patient comes in, maybe Missy this is where you start, but I'd like to know, or people that are listening, I'd like them to get a feel for how you work together on things, not just you do your job and you do yours. But again, I can see you're looking at
Like, I don't know how you want me to answer that question. Because I don't know. I think there's always an open communication. I think that's the big key.
But
with us.
that's the part where I'm interested to know, because I've been in dental offices, but I've never actually seen the communication between a hygienist and a dentist. But it seems like a lot of what I've been told is the kind of hygienist will identify an issue or diagnose something, and then you guys have to talk before. You can't talk in front of a patient, right? You can't go in there and go, well, I think you have this, but we haven't really figured it out yet.
Missy definitely preps me. So if it's something that's more serious, right? You would come into my office, close the door, and kind of talk to me in
Right.
person first. But then we have, I wear my Apple Watch, so when she needs me and it's not something
So you
that's
can
too
listen to your
serious,
iTunes while
no,
she's
but
doing
she'll
her job?
type in a message to me so that I can see it. I'm not wearing it right now, though.
Yeah. Well, you're not diagnosing.
No, I'm
anyone,
not
right?
diagnosing.
This
But
is
then
true.
she will point out things so that I can quickly read it on my watch. so that if I am busy and I don't have time to have a quick conversation in my office or whatever, then I can walk in and I'll still know what she wants.
That's got to be a real brief message. I mean, what is it, like jaw rotting off, coming soon? Like, what is that message?
No, you'll tell me, like, if there's a tooth that's
Right,
pain
right.
and number, tooth number 2.
Correct.
Oh, can I ask a dental question that has to do with something I watched the other day? Have you ever heard the term hot tooth?
Yes,
Someone said-
Yeah.
That's a thing?
that is a thing.
All right, because Don Draper got it, and I know people watch Mad Men. I watch it, like, all the time. But when he said he has a hot tooth, I'm like, what does that mean? Now I have 2 experts. Who wants to handle what a hot tooth is, by the way, just to solve my curiosity?
Well, I guess, how do you have when you have a hot tooth, it's something you can't numb, right?
Right.
Like
Hot
funny.
tooth is usually somebody's coming in a very short amount of time.
But
They
that's not a
have
real, that's like
pain.
what somebody says, right? They don't,
Oh no, it's considered
No.
a hot tooth. It is seriously a very painful thing in a very short amount of time. It's like it may have been perfectly fine the day before, and the next day
And
it
that
is
just comes out of nowhere.
excruciating. Yes, yes.
And I have a hard time getting the, like, for those patients, if they have, like, if it's that much pain, I have a hard time getting them numb. Because it's a hot tooth.
I just thought that was like an old schooly term, you know, like the 1920s.
Like, when a tooth is bombed out, when we talked about that, remember?
Well,
you're-
okay, first of all, I thought that was a legit way to explain
No.
a cavity, like if that tooth
That's
is all
dental talk.
bombed.
That's how we talk to each
Yeah.
other.
So if that tooth is bombed out, that's different than a hot tooth.
Yes.
I think we're gonna have to have a list of terms that we use on this show. Sorry, I had to interrupt there because I heard
Yeah.
that term, and I had to know if that was a real thing.
Yep.
Hot tooth.
It is a real thing.
If someone has a hot tooth issue, we should say that you guys can handle it, but you might not be able to numb it.
No, I can eventually numb it. There's definitely different tricks and stuff. But it's just, you know, if I do just the regular numbing that's standard and that tooth is hot and it's still being it's very sensitive and tender and reactive, then I have to just use different methods. And Missy, by the way, can numb. So that's cool too. A lot of people don't know that hygienists can do that, but she can anesthetize.
Can all of them do it?
They have to take special
You have to.
courses.
That's a,
So
that's
that's
a
the thing,
CE
yeah.
thing too.
That's a CE
Sorry,
thing.
continuing education thing.
It is. I mean, the newer hygienists are actually getting it in their classwork, but for those of us who didn't have that opportunity, it wasn't legal in the state of Ohio at that time, we have to go back, take the coursework, take another a board exam, and start all over with that.
Yeah, so they just don't clean teeth.
Well,
That's
okay,
correct.
I have another question because
Yeah.
we discussed Brotox, which I saw on. We were in the kitchen here. in
Are you
between
asking
shows.
if you need some?
Listen,
Yes.
look at me right now. I don't need it. I have this brawny paper towel guy beard going on. I don't need Brotox. But I did see a thing. Who are the 2 ladies that drink on TV? Kathy Lee and Hoda. They
Oh.
had guys on there talking about it.
Yeah.
And they were getting them done at dental offices, right?
Yeah.
And that's what you guys.
Yeah.
Is that, do you have to numb people for that?
No.
You
No.
just jab them.
And that's not me.
No.
No,
That's
but I
me.
just mean in general, like,
But the
isn't
thing
that...
is, I have to say that she has to know everything that I do so that she can explain to patients, which is, I think, really difficult. But she does a great job with it. So, like, with my Botox, I actually had to have to sit down with her and say, this is why I use it, this is how I use it, this is how it works. And then, so that she can explain to patients, because she's the one that's explaining most of the things first before I even come to the room. So that's I think that's,
That
like,
is correct.
yeah, so she has to, everything that I know, I try to
So
tell her,
you
even
have to
about the
learn more
laser.
than just, I mean, that's not dentistry, but you have to understand what's going on in the practice.
Enough to explain to patients, right?
You're right. Absolutely. And to even know enough about, you know, what sensations they may have, anything like that, because those are the questions they're going to ask. You know, I don't profess to know it all, so there are
A
sometimes
lot of people
where
will
I'm just
ask you questions before they even ask me.
Correct.
I think.
I think
Because
so
they
too.
probably trust you, right? I don't mean that just because you're you. I just mean like a hygienist.
I've
You,
spent
No, but
more
they spend
time
more
with
time,
them.
and
then- Right.
Yeah.
I think a lot of times they'll ask you, because if I step out of the room, they'll ask you, do you think that's a good idea? Should I go through it with that?
Oh, right.
And it's not a trust thing towards me. I think it's just because
I think
they've
it's a
been
trust thing towards you.
Stop.
And sometimes too, I think they feel intimidated just by the doctor name. It's not necessarily by you. It's just the doctor name, and then they are asking questions. Can you explain this more, or what happens if, or anything like that. And that's where I come in.
Yeah.
That's where I'm answering those questions.
That's pretty brilliant. I can see that you guys get along. I mean, other
I
people.
love Missy.
Well, very well.
She is one of the best hygienists I've ever had to work with, and she gives really, really good cleanings. Like,
Oh,
I mean,
That's the best.
it's very
Best
thorough.
feedback to hear.
Does that
No,
make
but
you feel good?
It's
It
very
does.
thorough though, like, because I am a perfectionist. So
No. What?
But I can tell, like, that she is just as much, and she's really looking at my teeth. And I mean, her cleanings are phenomenal. I love them. But
Did you handle Andrew? I think you've handled like 3 or 4 people we've sent over.
yeah,
I
he's
have
handled-
seen.
He's
a
a
few
monstrous
of them.
person.
Yeah.
Yeah. Very
We
kind
can't talk
person.
about it because of HIPAA.
I didn't say his last name, but if you look him up on your Instagram, you'll definitely see him. So that's not HIPAA. Is that a HIPAA
You're
violation?
giving too many clues. People can investigate.
No one's gonna find him just because he's on one of my other shows. Plus, I didn't
That's
give any
another clue.
scoop
That was
away.
another clue.
He just said he has clean teeth. Missy, I also want to ask this question because we're almost out of time. Preventative care. Do you guys have a preventative care kind of package or something that you guys do specifically for new patients?
Right, we do. I mean, everything is pretty consistent with new patients. We try to get a good view with x-rays of the underlying areas and any problems of concern that we may
Yeah.
not see by just looking clinically. And that's important for Dr. Sauer to do a full comprehensive exam.
We're talking mostly about, like, the people without insurance.
Oh, without insurance. Okay. Yeah, without insurance, definitely. We do have a package that just breaks everything down into a smaller fee. There's no insurance that's covering any of it, and so they're coming in and getting their cleanings, their exams, their x-rays, and fluoride treatments twice a year, and at a smaller fee with no insurance.
And I also have to say about Missy, though, like, when you meet her, when you come to my office at 6605 Longshore Street in Dublin, Ohio, she's probably the warmest person that I've ever met. So
She
she
brought
will.
muffins today.
She brought muffins,
She
and
did not
she
need to, but
no,
she
but
did.
she did. Well, it was from us, but like she will make you feel so comfortable. And she's just very warm and nurturing. And so if you're nervous about coming in and and seeing me, I get it. And like a lot of people don't want to see the dentist.
Well, you're intimidating. You're over 5
I
foot
know.
tall.
I'm very intimidating. My hands are so large.
Yeah.
But Missy, when you meet her, you'll understand what I'm saying, and she will definitely listen to you. And I think you'll get a very good experience, which is why she's part of my team at River Park Dental.
And that's why we're glad you're here, because I think one of the things is we talk about the hygiene aspect very little on the show because we're talking about so many different topics, but it's nice to actually let people know.
But it's
the
like the
people that
biggest,
work it.
one of
Right.
the biggest parts of
It's
practice.
got to be 85% of the
I mean,
practice
you're
is spending time with your
seeing people
hygienist.
every
Right.
6 months.
Right. And
So
it's
that's-
definitely a judgment-free zone with me. It just is.
Yeah, at least one of you over there is. Phing, that's it. I think, can we let people know how they can get a hold of you if
Yeah.
they need any dental-related issues?
Yes.
Hot tooth and all?
Hot tooth, bombed out teeth, whatever. You can call us at 614-689-8686 or visit us at riverparkdental.com. And also, happy Mother's Day, because this is going to be, playing
It
on
is.
Mother's Day.
Yeah.
To all the mothers out there. To Missy,
You gotta say
grandmas.
that a different way. To every mother out there. Not all the mothers out there.
All the mothers.
To all you mamas. Happy Mother's Day.
Happy Mother's Day. Don't forget Michael.
No, I won't. Thank you. You've been listening to the River Park Dental Show.
riverparkdental.com.